Our community is not harmed, burdened, or impacted in any way by what sex is written on a person's birth certificate, marriage certificate, or death certificate. But we are deeply impacted every single day by our lack of access to mental health services and substance use resources, which is really where the real crisis lies. While this board focuses its attention on political distractions, our county administrator, under your oversight, has allowed our local health department's entire mental health unit to get fired and dissolved. It didn't happen because of a lack of need. It didn't happen because of a lack of funding. It happened because of failures in leadership, failures in accountability, and failures to prioritize what actually matters to the people who live here. While that was happening, instead of addressing it, this is what you've chosen to dedicate your time to. Let me share one example of what is at stake. For those of you who do not know, Houghton County received a $2 million grant in 2024, specifically for substance use services in our community. That funding was intended to support the behavioral health unit of the health department and to strengthen our local treatment core. Do you know how much of that $2 million has been spent in 2 years? Less than 10%. That is it. Because of our county administrator's mismanagement and this board's unwillingness to hold her accountable, that money designated to save lives, support families, and reduce the burden on our court and emergency systems, has sat unused. And now that grant funding is at risk of being removed from our county. Meanwhile, families in crisis are being turned away, people struggling with addiction have nowhere local to turn, counseling services have disappeared, 8 people lost their jobs, providers have been displaced, and those of us working in this field have watched clients lose continuity of care because of leadership failures, not because of a lack of resources. So I ask you, how can this possibly be a priority? How can a debate about certificate terminology take precedence over the collapse of our behavioral health infrastructure? Our community deserves better, our families deserve better, and the people suffering silently in this community deserve better. It is time for accountability.